more minute,
yeah,
and see if a few people roll in, and then we'll go ahead and get started. And
that was so cool. I see everybody.
Oh, I see my neighbor with her 2 little kids outside. Oh, they have been such a delight just to watch them and talk to them. They've been just, it's interesting how quickly, I mean, it wasn't like super quick, but within about a week or so, they all got into a routine. And it was very nice, delightful to see that the first week they were like protesting. It's like, whoa, we want to go to our daycare, we want to do this, that. Why isn't grandma coming over? Normally the grandma babysits them and stuff. It's like, why isn't that happening? And now they're like, yeah, let's do this, let's do that. It's amazing to see that.
That's nice.
well, I think we can go ahead and get started. We'll be admitting participants as they come in a few minutes late here, but I'd like to welcome everyone. Good morning. For those of you that don't know me, I'm Meg Ritchie with the Melbourne Regional Chamber. Before I introduce our program and our speaker this morning, just a few housekeeping. If everyone could mute themselves right now, that would be wonderful. And we are going to be taking questions throughout the presentation. So if you have a question, please put that into the chat. And my colleague Stacy Donovan will be monitoring the chat. And if you have that question, put it in the chat. She will ask you to unmute yourself. We'll call you out. We'll ask you to unmute yourself so you can ask the question to the group. Other than that, I think we can go ahead and get started before David, I think David Cable was trying to share his screen. David, can you unshare your screen for us? Although we love that photo. Yeah, it's a beautiful photo. It's a beautiful photo. There we go. Well, welcome, David Cable. Again, I'm Meg Ritchie with the Melbourne Regional Chamber. Welcome to How to Positively Navigate Challenging Times, led by Coach Jaya. I have the pleasure of introducing her and going over only a few points in her very impressive resume. Coach Jaya practiced as an MD as an infectious disease physician in Bombay for over a decade. She was a WHO collaborator and professor in Grant Medical College. She was on the front line of the response to epidemics or pandemics.
She pronounces her name Jaya. I call her Jaya all the time. She never corrects me.
So actually, I think we've got Center State. Is it Center State Bank that made? Can you put your on mute? There we go. Okay. Can everyone hear me now? Okay. Okay, great. Since migrating to the US, she has been teaching infectious diseases and public health to chiropractic, nursing, and other healthcare students for over 25 years. She also has a master's in public health with a concentration in emergency preparedness and disaster management from Benedictine University. She has consulted with the Chicago Department of Health and her alma mater, Bonner in Indiana, during H1N1 pandemic. She also has worked with Pinellas County Emergency Management for Community and First Responder Education, as well as the Park Medical District Business District during Ebola and Zika pandemics. She trained in the Community Emergency Response Team, and that she was a member of for Psychology of Disasters. Now she focuses on lifestyle, health, and wellness coaching as Coach Jaya. We are so excited to have you this morning. And it's my pleasure to introduce you, and the meeting's yours.
unmute myself. Thank you. And thank you for joining us. I just wanted to share a few of my perspectives and strategies that I have used, as well as I've learned so much in last few days as well. I've been on a variety of calls about how we respond as a world and individuals and communities and so on and so forth. So thank you. And there is a lot of wisdom in this group itself. Each one brings our own experience, and I think I would welcome to share that with you. First of all, you'll always see the smile on my face, because when you smile, even if it is for 5 seconds, it signals your brain that you are not in immediate danger. Okay? It's an important thing. So smile is a very powerful tool. And we'll talk about that in a minute. But what I'm really going to focus on is what you can do as an individual in this pandemic. And I will talk a little bit about how pandemics differ from other disasters and why we need to really understand how our responses and not reactions, but responses need to be tweaked and need to be changed. We in Florida are used to hurricane preparedness. Hurricanes come, we have a hurricane season, but again, hurricane as disaster is a one-time thing. Of course, there is an aftermath. And we are kind of, it's a kind of known thing a little bit, unless you are like me, who was from Chicago and came over here. Oh my God, my very first hurricane really that I went through with even if it was just not even a Cat 1, was Irma. And I can tell you that I had a level of anxiety and fear. So I understand how new things affect us differently. So smile is a great way to signal your brain. It's like, okay, there is no saber-toothed tiger in the room where you're sitting. It's okay. No one is going to eat you today. So it's an important thing to keep in mind, but please understand that it is perfectly normal to feel anxious. So I'm going to share my PowerPoint, but the PowerPoint, it really is about a little anchor, a little something that you can actually, and I'll make that PowerPoint available to the Melbourne Regional Chamber so you can download it really. But it really is about understanding how we react versus respond. And that's an important thing. So I'm going to share my screens. Just bear with me for a minute. And we're going to go right in here. Oops, I want to go to show. There we go. There we go. All right, there we go. So as you can see, as a professor, I dream in PowerPoints, I think. But I like this graphic because we have to remember that we do have this bounty of beaches and shells and sea life around us. So that's why I chose that, because I think it is really important for us to remember. So what we do is we navigate. So what does navigate mean? It means you are in control of certain things. And there are certain, when you navigate a sailboat on the seas, there are some things that are in your hands. Your hand should be firmly on the wheel and know what your surroundings are. But you don't have any control over what the sea is going to do, right? Maybe there will be swells, maybe there will be large waves, or they may be calm and beautiful weather. But as long as you're navigating towards positive ones, and it's a choice, right? We have a choice of how we navigate our sailboat, and understand that you don't really sail alone. You bring with you the community who taught you how to sail, all of that. So there is a lot of things that are going to be helping you. But number one that we're going to talk about is we need to acknowledge the challenging times and effect that it has on us. Then we'll talk about strategies to manage your personal stress. Then strategies to manage your family stress, especially children and especially teenagers, as well as elderly, but especially teenagers. And what can you do to plan, prepare, respond, and recover? Remember, I didn't say react, I said respond, okay? And I will talk a little bit about plans and not being married to plans. I think that's important, okay? first of all, acknowledge that anxiety and fear are normal reactions. They're normal. Here's what happens to us as business leaders, as leaders of our families. We tend to be the strong ones. So we think, oh, we can't show our anxiety or fear, because then what will my kids think? What will my rest of the family or my employees think? It's okay. In fact, if they see your genuine you, that you are also anxious and fearful, and yet you are responding and not reacting, they will take that cue from you and shape their reactions or response, really move from reaction to respond. Because, and those of you who are members of the armed forces know this very well, that when you're preparing, what do? You acknowledge your fear and go forth anyway, right? That's the very definition of courage. Very definition of courage is feeling the fear and responding in spite of it, or acting in spite of it, acknowledging it, not pushing it aside. It's like, yeah, we are anxious, we are fearful. So I want you all to take 5 seconds, just 5 breaths, deep breaths with me. Feel that anxiousness and fear and say, okay, I'm aware of you, I accept. I just want you to take 5 breaths with that. I don't know how this pandemic is going to evolve. I don't know what other things may come once we open up, but it's okay. I have tools at my hand that I will use. I'll be nimble, but I'm feeling anxious and fearful, and it's okay. If you do that, just for a minute, okay. Just take a deep breath and let it go. Okay? So don't skip the number 2. This is what we tend to do. When we react, we go from awareness to action. And it is a natural reaction of the body, because that's how we have survived these thousands of years. We heard that rustle in that jungle. We knew there was a saber-toothed tiger from our previous experience, or we thought it was. And so we reacted. That's normal. Okay? That's okay. Anytime we heard that rustle, we had that anxiety and fear, and we reacted. But we just need to accept that this is a longer thing. It's not a saber-toothed tiger. There are a lot of unknown things in any evolving pandemics, even in known diseases with epidemics. We never really knew when we responded. We never really knew the ground realities and the little nuances that were going to impact it. So we were aware of it. We accepted that, yeah, it's going to be messy. It's not going to be perfect, but we are going to bring our experience and hope and deal with it the best way you can. And this permeates, it projects from you outwards. So accept that, okay, it's anxiety and fear are normal. What we do with it is what is important. So instead of going from awareness to action, accept it. That frees up your mind. So when you accept the reality of challenging times, like when you go on the boat, on the sea, if you see it's choppy, you can't be just letting it be on autopilot, so to say, right? You're going to have your hands on the wheel. You're going to be more aware of what's going on around you. Or if you go to swim on the beach, you're aware of where the rip currents are. So you're going to avoid that area, things like that. So you are responding because you accept that, yeah, rip currents are a reality sometimes. We are going to accept that. So let me just give an example, Chris, of your crew. You've got thousands of applications and clients to look at and help. So it's going to feel overwhelming. It's okay. Yeah, you're going to feel overwhelmed, but understand that one client at a time, you can help. And you are making a difference, one client at a time, one person at a time. When I talk to my health coaching clients, they're also feeling anxious. So again, it's one client at a time. I can't impact 330 million people at the moment. I would like to, but one client at a time. But it also allows our minds and hearts to be creative. Like Professor Laurie was sharing, that Barry University might be doing something for elevating issues for nursing home residents or assisted living facilities residents who are feeling a little isolated and their routines are disrupted. So again, our minds and hearts become creative. And this was another lesson learned when we responded in city of Chicago for H1N1, the mass vaccination. Imagine we had to effectively do about 100,000 vaccinations in a matter of 2 weeks, right? It's a mammoth task. It's not easy. And here's what the leaders, it was very impressive. They said, yes, everyone has got a job or a piece of this puzzle. So you may be departments of streets and sanitation giving us vehicles and roadways to go from one end of Chicago to the other. This is the supplier for the syringes and needles that we're going to need. This all those different places. Colleges who are opening up their gyms and auditoriums for us to be able to do the mass vaccination. Everybody is going to come with a problem associated with that, but also come with two types of solutions. Solutions as what we can do as a group and what would be you doing as a group. So once you start looking at the problem and making those little columns in your mind or on paper is always great, then it starts become a response rather than the reaction, okay? So try this, take the littlest of the problem and see how you can do response versus reaction. What can the community do versus what can I do? Little things, and that makes a difference, okay? So for example, my diabetes is under control. I'm no longer high risk, but I don't want to go and be, in the big Walmart. So I use Walmart pick up groceries. What does that mean? It means I need to plan what I'm going to shop for. I can't just say I'm going to walk these aisles and see what is on sale and I'm going to buy it. Now I have to plan for the groceries, and that's fine. So I'm planning the little shifts of, it's going to be really good for me because I won't do temptation buying either. And I think I'm going to carry that habit forward. So little shifts that you can do, that will happen in the response mode than that. So what are the important things, like even, I think it was Professor Laurie who was sharing that. If you must stay at home, which many of us do, some of us are essential workers, so we are going out of our house to the house like the banking folks as well as realtors and many of the others are doing. Make sure that you are maintaining a healthy lifestyle. And these 4 areas are really, really critical. Healthy food, not junk food. Why not? Well, why not go for that whole bag of potato chips because it's comfort food. Well, here's the thing what happens. Many a times they push your blood sugar up and then the blood sugar goes down. And when it is down, you get that brain fog and you're not able to then focus well. And when you can't focus well, your creativity doesn't flow through. Or if you are so busy taking care of everybody else because you've got 100 applications to go through or whatever it is, if you don't feed yourself, then number one, it takes you longer. You may have to read the same paragraph twice, if you will, and say, or email, when my students' emails and things like that, I may be reading them twice or thrice instead of once. If I am feeding my body throughout the day healthy food, then I am not having the brain fog. I'm feeling better. And again, you're modeling for your family how you need to be when you are dealing with challenging situations. So it's easy. And again, healthy food, not so-called comfort food. Let healthy food be your comfort food. So you're redefining for your family what comfort food is. When I watch what my daughter does for dinner, and she's working 3 times as hard as she was, in fact, more so than before. And again, she has that habit. She was my client. So she has that habit of feeding herself throughout the day. And that allows her to do some of those long hours that we may have to put in. And one of the important things is sleep, okay? Sleep is one of the best immune builders you have. Your immune system loves sleep because that's how it can really, your brain, your immune system, all your systems in your body need that downtime. So establish a routine. And especially it's very hard because you're so tempted because there are 10 more things that you want to do before you think you can afford sleep. understand that if you don't sleep well, or if you don't have a routine, that you will have a little more difficulty sleeping, right? So what is my routine? I dim down all the lights in the house, and I never take my work into the bedroom. I never sit on my bed with my laptop to do anything, because bed should be associated with rest and sleep, not with anything. If you can't sleep, where you try to sleep, you can't see, you don't seem to be able to sleep, get out of bed, sit in a chair, sit wherever it is, and one of my techniques for when I'm anxious, and give yourself a break. You might be anxious. Like Sunday, I was not able to sleep Saturday night and Sunday morning. I mean, I was not able to sleep well because something happened in the technology side for the colleges that I teach, and that could not be resolved till Monday. And I was like, oh my God, how are we going to do that? That was my reaction first. And then I sat back, but my brain tried to keep on thinking about a solution for it. So I wasn't able to sleep well. I got up from the bed. I sat in the living room. I looked at some of the things, wrote down all the things that were bothering me. And then I was able to feel sleepy and go back to bed and sleep. Now, I didn't get my full 8-hour complement. I got about 5 hours. But yeah, give yourself a break. It's going to be like that. You can take a nap in between if you can. Maybe when you come home, if you are going out to work, come home and just sleep, like sit in a chair with 5 minutes closed. And that's okay. That again signals your body that you're at home, time to calm down. You were at high end at that point, now you're calming down. And that actually helps you. So sleep routine is really important. Don't watch news just before going to sleep. All of those things are going to make your brain alert, your sympathetic system, rather than your parasympathetic system, which is the rest and digest and rebuild system, okay? And give yourself a break. There will be days where you will not, there will be nights where you won't be able to sleep. It's okay. We are not in a peace, even keel, normal situation. That's okay. And healthy exercise, even if it is in few minutes in the yard, like I still go out for a walk. I'm thankful and grateful that I have sidewalks everywhere where I can walk and I can maintain the 6-foot distance and all of that. No problem, I can still do that. But it was interesting that one of my friends who lives up in Chicago, they couldn't go out. They had snow, and they were not able to clear the snows from the sidewalk and all that readily. So she was just climbing up and down the stairs in her house. Just that exercise, that movement made her body know that she wasn't running away, and it was gentle. It was comfortable pace. She wasn't like running up the stairs and down. She wasn't doing her unless she was doing cardio, but she wasn't doing that. So again, signaling her body that she's not running away. It's not in danger. She's just getting her little exercise. And it's good because we are sitting in front of the computers like 6 hours a day nowadays. Get up just walk around 5 minutes or so. Okay. So that's important. And, or do like what the Italians do, the social contacts while physical distancing. I think I was really impressed at how Italians were singing across the balcony to each other because they couldn't get together. They're singing to each other. And, do that. Have the social contact. In fact, if you will, a added bonus of this time has been, I've heard from family members from across the United States, whom I have not spoken with in 2-3 years. So I looked at those positives, like, would I have heard from my cousin Kedar from Washington, D.C., because he's so busy, 2 kids, he's in IT, he's so busy, but he took those 10 minutes to talk to me on WhatsApp. It's like, yay. So again, keep those social contacts while physical distancing. It's okay, and again, it's going to be a little messy. It's okay. It doesn't have to be perfect. It just has to be there. Just a little smile. And I'll share again with you my experience when we used to be in surgical teams and we were dealing with major emergency or major bleeder and things like that. Well, after the surgeons did that very consistently. When they took care of it, they stopped the bleeding and all that. They would just look up and smile with their eyes, because that was all that was visible, right, to all of us. But they took that 2 seconds to look at each one of the team members and smiled with their eyes. There was no hug, no shake, nothing, just smiled with their eyes. And that was enough to reassure everybody that's okay, we got this. Okay. So keep that in mind when you're doing social distancing. Is important. Find healthy ways to cope. Don't use smoking, alcohol, other drugs to deal with your emotions. Your emotions are an important part of you. We just have to let our front of our brain, our response brain, then react brain. Emotions are important for us to feel them, acknowledge them, but don't dampen them down. They have, it's like my grandmother used to say, if you put a pile of a mountain of dirt on the top of a worm, it still finds a way to the top. It will take longer, but it will bubble up. So emotions are like that. Keep that in mind. Okay. If you feel overwhelmed beyond doing what you do normally, talk to a health worker, a counselor, have a plan where to go, how to seek physical and mental health needs if required. I put a SAMHSA.gov, there may be some other ones. Remember, 211 system may be overwhelmed. So find other ways, maybe through your church, to your faith organizations, what have you, okay? And most importantly, get the facts. Well-meaning friends keep on sending me links to the blogs and things like that, and I just don't. I go to Brevard County Health Department, their website, or Florida Health Department site, and what the community is, what chamber is putting out. That's where I go and look at as to what I do in addition to my professional contacts, the APHA, Institute, National Academy of Medicine, and WHO, all those. That's where I get my facts from. And again, I always look at it, okay, that's what's happening in the world. What is happening in my sphere, that little sphere that I have, okay?
Hey Jaya, I just want to interrupt. We have a couple people asking some questions.
Yeah.
If
This was where I was going to stop to answer those questions.
Okay, thank you. Perfect. I'd love to have Alan Bernstein unmute himself and ask his question, please.
Yeah, go ahead, Alan.
Jaya, thanks. Yeah, this is really great. Thanks for taking the time to do this for us. You were talking before about going outside, and certainly we need to breathe air. But what do you think about this, the concept or the process of wearing a mask outside? Like, do you wear one with your experience in infectious diseases? Do you think it's necessary, not necessary? What are your thoughts on masks?
If I'm going into a place where social distancing is not possible, like if I were to go inside a grocery store or a CVS or anywhere, I would wear a cloth mask only to, number one, reassure people. Number two, if I were to sneeze or cough, to protect that, right? If I were to go and volunteer in a hospital, that's not going to do any good for me, okay? Because that will be, but that's where I will, but when I'm walking on the sidewalk, I can easily maintain the 6-foot distance. I don't need a mask on my face, okay? But if someone feels uncomfortable when they are in that surrounding, and if a cloth mask is what is needed, I'll do that. Like, for example, when I traveled to Arizona, it was just before this really unraveled, right? It was before that. And we couldn't get back with the, other than our original flights, we couldn't get back sooner because airlines were canceling 90% of the flights. So we were stuck in Arizona. So I had my scarf with me. We didn't have a place to make masks. And I did not want to buy a surgical mask, an N95 mask, because I wasn't taking care of sick people. I wasn't sick. I needed the healthcare workers to have them. So I wasn't going to go to Walgreens and Walmart and anywhere else to get those things. But I had my scarf with me. I had tissues with me always. So I was going to sneeze and cough if we had. So that's what I was doing. I was again doing social distancing. I was following these important precautions, because I'll tell you, when we responded in rural India for epidemics and pandemics, especially respiratory and especially measles epidemics, that was the worst because measles is far more infectious than even this is. We used our handkerchiefs, 3 folds, different things so that we had some barrier. We actually used to put a little plastic bag inside. So we had a little bit of barrier. Was it perfect? No, but did we keep the social distancing? Did we wash our hands? Did we wash our faces? We did that to minimize that. So right now, when I'm walking on the sidewalks, I can move away 6 feet. I don't wear a mask. But if I'm going to go inside a grocery store, then I will. or I always have a cloth mask next to me on the seat. If when I go to do Walmart pickup and that associate comes to talk to me for any reason, then I'll put that mask on so they usually have that and she feels comfortable and I feel comfortable and everybody's great. I wash my hands when I come back. I make sure that they're well protected, so it's not like I put moisturizer so that I don't crack my hands using all these washing and hand sanitizers all the time. So these are some very simple precautions that you take, which works. It works, actually works. So mask, it's more if you are likely to not be able to do social distancing, then that's okay, do it. But you don't need a N95 or a surgical mask. And that disturbed me a little bit when I was traveling back from Arizona. And again, remember, this is when the social distancing and all of that was happening. I saw a family with little kids with masks on their face, surgical masks, okay? The ones that were in short supply. And they were handling the mask, they were putting their fingers in, they're rubbing their eyes with that. So it was a waste of scarce resource at that point. And I didn't say anything. I just kept my 6-foot distance, kept there. I wasn't about to lecture them because it's what they're doing with that is they didn't want me adding to their anxiety. They did not need that. But I know when my daughter asked me, do we need to do that? It's like, nope, make sure you have tissues and stuff and hand sanitizers. And we did that. We took care of important precautions, but we didn't go overboard. We didn't go into the hype. We just didn't, because I know what works and doesn't, and what they are telling you to do is what works. So follow those public health recommendations and just do it. Because they have the facts in their hands. When the EOCs respond, which is what Brevard County has their EOC, they have the facts. So just deal with it. Follow their advice and you're okay.
Jaya, we have a couple more questions. If I could
Please.
ask Meg and Lee Guthrie to unmute themselves to ask their questions.
Sure. I mean, I guess I wanted to know more on your thoughts. You know, once we enter recovery, are masks going to be necessary to do business, or is it more so for people to feel comfortable? I mean, obviously we have to be following the guidelines, but
one of the things is if the social distancing is a harder part, if you can't keep a 6-foot distance between you and the next person, then wearing a mask gives you a protection. But it is not a substitute for washing your hands and making sure that you're not touching your face with unclean hands. And that's the other thing. A lot of people, but I touch my hands to my eyes. Oh my God! If it was an unclean hand, then it creates a problem, not otherwise, okay? So masks, 2 reasons I would use. Number one, if you can't do the social distancing, like you're going into a more crowded, you don't have a place to have that distance. And 2, if you feel the people, your clientele who are going to come are going to be anxious about, like you're dealing with elderly populations and things like that, then you wearing a mask might help them feel better, okay? And it will help you. So if you have to sneeze because you have allergies, they don't freak out.
Okay, how about Lee Guthrie? You want to unmute yourself, please?
All right. Hello.
Hi.
Hi, Jaya. So yeah, I'm a big proponent. It's probably no big secret. I love a lot of the things that you're talking about here, but as we're going back to work, this whole idea of social distancing, which I believe we'll all have to continue to do it, just as we should do for flu season, we eventually have to build up a herd immunity so that we all can just start functioning back in the normal world again. And so I was kind of looking for your thoughts on that.
Yeah, herd immunity is in a novel viruses, takes time, okay? And one of the things that we have to know, and that is usually a retrospective study, if you will, we look back and then we learn, unfortunately. So herd immunity takes time for novel viruses. And we want to have it, but it's the balance between what will be the fallout of having that herd immunity. Okay. So while social distancing in the flu season, and again, social distancing, this is what I used to do. When it was flu season and I was teaching students, I used to teach 100 students. They used to be in class, 100 students. And they would come in, even if they had these symptoms of flu, they would come for the exam. They would give me their papers and all that stuff. So I was more conscious of my personal hygiene during that time. Okay. I was washing my hands before I ate. I was using hand sanitizers if I couldn't do that. And there wasn't a lot of social distancing when you're working in small groups, when you're working together in a lab environment. There wasn't a lot of that we could do. So I was more conscious of my personal hygiene at that point to prevent infection, okay? Because at that time, my diabetes was not under control. I had asthma. So if I had got flu, I used to get flu vaccine, but there were some years when the flu vaccine was only 50% effective. So herd immunity cannot be relied on in a short term. It can be relied on a longer term. While it is desirable to do herd immunity, to have herd immunity, it may not be in time enough for us to rely on that. So
okay, but so there's really, so I guess back to, so not to interrupt you, but so if you're not going to do the herd immunity, then you're going to stay in your house, because those are really the only true options that go with that. I mean, I guess some people will opt to do, some people will opt to do the vaccine, but there's no way that's.
No, the vaccine won't even be available. And normally the vaccines take about 10 to 15 years to really go through. They've shortened it to 18 months, but even then, but here is the thing. Okay.
So I know, but can I?
To stop the transmission of infection. Okay. And we have learned in last 6 months how this transmission is occurring. And I think one of the simplification, which is getting in the way of people focusing on what really stops infection, is who is transmitting it. And we keep on hearing asymptomatic. It really is pre-symptomatic, means they are feeling a rundown feeling. Once you look at who is transmitting most of the infection, somebody who's already sick is the most likely to transmit infection. That accounts for 75 to 80% of transmissions. Someone who was sick. Okay. Then the next 10 to 15% are those who have some symptoms, but not a lot. And then you have 5 to 10% remaining ones, which are pre-symptomatic, not completely asymptomatic. Would you have a few outliers, which are like 1 or 2, and that's what shows up on the media and all those places where they couldn't identify where they got infected because they're not paying attention to how this virus is transmitting. It's not just by respiratory means, also by touching surfaces which were contaminated and not washing their hands and not taking those basic personal hygiene parts of it. So can you go out once these restrictions are lifted and do it? Yeah, maintain your personal hygiene. I grew up in a third world country, if you will. Public hygiene was dismal or non-existent in most places. So how did I not get cholera? Why did I not get typhoid? Why did I not get flu and all the other things? Because of personal hygiene. That's it. And that's fomite transmission or surface-based or hands transmission. Hands are the biggest vehicle even for coronavirus. And people don't understand. We are doing this social distancing for respiratory transmission. But this is the other piece, that if we pay attention to be mindful of our personal hygiene, you don't have to be cocooned in your home. You can go out.
And so by that same standard, then we should be going back out and learning not to touch our face, building our immunity. And there's a lot of studies about vitamin D and getting outside in the sunshine actually being a bigger proponent for actually building up your immune system. And I guess, so what are your thoughts on the vitamin D versus vitamin C?
You see, our immune system needs all kinds of support to be able to respond when it comes across that threat, as well as maintain a certain degree of readiness, right? So if you're deficient in any of these different things, or if you have a little more supplementation to get it going, great, right? So there are two ways you can prepare yourself internally by providing that one little piece of vitamin D. Another piece is that is not, none of those things are substitute for preventing transmission. Prevention is always better than cure. But you can do both of those. If it works for you, yes, go for it. And again, always ask for people who know how much of vitamin D you should be taking. I mean, I wouldn't take 10,000 international units. No, my age group, that's too much. And how long am I going to take it? Am I going to take it for 2 years? No, that's not good. It actually has other side of the story is that if you have more than 5,000 international units for long term at my age, it can actually adversely affect me. So again, go with like someone like you can advise people as to how much they should have, or a nutritionist can. So you can do that. You can do healthy lifestyle, healthy mind, healthy body are two most important things. Healthy sleep, all those things are going to support your immune system. Go for it, okay? But also pay attention to prevention. And it doesn't mean that you have to be a germaphobe completely, but at the same time, minimize physical contact unless you have to. And that's okay. I mean, yeah, go hug your kids. It's okay. Go, that's all right.
I'll hug my neighbors.
Jaya, thank you so much. And I just want to say thank you to everybody to your questions. We're going to, for the sake of time, let Jaya get back to her presentation. Yeah. And if anybody wants to stay after the meeting to continue asking questions, we'll open that.
Okay, so I'm just going to go through, I've been talking about that. There are many other ways also, meditation, faith and prayers, they're important, and family and community connections, which are uplifting and supportive. Turn off, I mean, I have some really, really dear friends who send me these very negative things, and I just say thank you and never open those things. I just don't. It's like, no. I don't need to know that. Thank you. Even some of my professional colleagues, okay, I tune them out, if you will. So I'm going to give you a story of a squirrel. It is a really quick story. It's important, okay? You might feel overwhelmed. It's like, oh my God, this is global pandemic. What can I do? So this comes from an ancient epic in India called Ramayana. So Lord Ram or King Ram was building he had to build a bridge across from mainland India to Sri Lanka so that his army could do what it needed to do. And they were putting these huge boulders in the ocean. It's in the Indian Ocean, at the edge of that. So they were doing that, and he watched this little squirrel. So he had these mighty warriors putting those boulders in the sea. This little squirrel was rolling about in sand and clay and going there and shaking her tail to put all that clay and sand in between those boulders. And slowly but surely, remember, this is a tiny little squirrel, but slowly but surely it was acting like a mortar and was holding those boulders together against ocean waves. So be that squirrel. You may not be able to flatten the curve all by yourself, but you can do what you can do, okay? Be that squirrel. It's like that quintessential story of after a storm, a man walking on the beach, seeing thousands of starfish on the beach. And he says, oh my God, this is a disaster. We can't save these. And he sees a little boy ahead of him walking, picking up one starfish at a time and throwing it in the ocean. So he walks up to him and says, what possibly can you do with that one starfish? You can't change this disaster. He says, well, it made a difference to that one, the one which I just threw in the ocean. That's what you do. Be that kid, be that squirrel, okay? And another important thing to remember is coping stress in kids. They're going to be clingy, they're going to be anxious, they might be withdrawing, angry. It's okay. Again, you be the calm, the voice of calm, respond, support them, listen to their concerns, and give them love and affection. That is important. But it's also establish a bit of a routine for them, a different routine. Literally have a little chart on your refrigerator, just like they are used to seeing in their daycare and the school. Monday, we are going to do this. Tuesday, we are going to do that. Have some time for fun as well. And schedule an office time for yourself and have school time for kids, and especially for teenagers. please make sure, especially high schools and teenagers who are concerned about their college admissions, when is the college going to start, how is the first semester going to look like, all of that. Be proactive with reassurance. Universities are already sending out information. The schools are sending out information. Go over that information with them so that they're not, because they're so anxious, they may be reading things into those instructions which are not necessarily correct. So be aware of that. And again, you know, I heard from a client of mine who lost her job, and her husband also lost his job. So now they can't send their kid to the college of choice that he wanted to go to because they won't be able to pay the tuition. So they got together and strategized, and now he will do first year in a community college and then move over to the college of his choice later. So again, being together and figuring out some of the solutions helped him. And otherwise that young man was almost so depressed that he didn't want to even look at anything, do anything. So be proactive that way. And this is what I want you to think about. Even a little hand is a huge comfort against mighty ocean. That little baby who is seeing that big ocean for the first time, is that the bigger sister any bigger than the ocean? But that little hand is all that it needs. So be that hand, be that, and it's okay. You're not going to do it perfectly. It's perfectly fine. That's what imperfection is the best perfection you can have. Okay. So please remember that it's going to be messy. It's not going to be perfect. I learned this from our emergency management, emergency responders, the paramedics. They said, you know, when we come at a site of accident and we need to transport the patient and he has a fractured arm, we don't care how perfectly we bandage it and immobilize it. We immobilize it and get them into the hospital. Even if they arrive in the hospital imperfectly bandaged, it is perfectly fine because we got them where they need to be. And it's okay. It's not going to be perfect. We're going to have a little arguments back and forth about how to solve a particular problem. It's okay. That's the nature of the beast, and it's okay. And that will be a lesson for that young man and young woman going forward when they encounter their own difficulties as well. So I want you to think about these. These are the two symbols which go together when crisis is written in Chinese. The first one is for danger, but the second one is for opportunity. And it's always put together. It's never put one or the other. It's always together. And keep that in mind, that here is an opportunity for you to think about what it may be. And again, we are in it for together. If there are any questions, I would like to answer those now. And then I'm going to leave you, for those of you who have a time. I'm going to share something else with you. Okay. I'm going to escape this for a second, because I want you to have a little bit of a fun as well. Okay. All right. So are there any questions I can answer at this point?
I don't see any other questions in the chat. If anybody has a question.
And please feel free to email me, send me a text, because, you know, I'm getting a lot of spam calls too, as I'm sure you are getting them too. So send a text so I know that it's coming from you, and then I will definitely take the phone call as well. But if we are ready to kind of call it a day, I want you to see this. If you don't see it all, it's 2 minutes and 14 seconds, I think, but 12 seconds. But if not, go and watch it afterwards. There are a lot of great lessons to be heard in this.
Look for the bare necessities, the simple bare necessities. Forget about your worries and your strife. I mean the bare necessities are Mother Nature's recipes that bring the bare necessities of life. Wherever I wander, wherever I roam, I couldn't be found off my big home. The bees are buzzing in the tree, make some honey just for me. When you look under the rocks and plants and take a glance at the fancy ants, then maybe try a few. The bare necessities of life will come to you. They'll come to you. Look for the bare necessities, the simple bare necessities. necessities. Forget about your worries and your strife. I mean the bare necessities. That's why a bear can rest at ease with just the bare necessities of life. Now, when you pick a pawpaw or a prickly pear, and you prick a raw paw, well, next time, beware. Don't pick the prickly pear to the paw. When you pick a pear, try to use the claw. But you don't need to use the claw when you pick a pear of the big pawpaw. Have I given you a clue? The bare necessities of life will come to you. They'll come to you. Oh man, this is really lemon. Look for the bare necessities, the simple bare necessities. Forget about your worries and your strife. I mean a bare necessities. That's why a bear can rest at ease with just the bare necessities of life. Yeah, with just the bare necessities of life. Yeah.
So the reason I wanted to share that with you is too, that of course it allows us to focus on our bare necessities. But did you realize that that bear just gave an important lesson to Mowgli? And then just as he provided at the beginning the banana to Mowgli, Mowgli turned it around and gave him the banana when he was feeling low. I think that is an amazing lesson to learn. So when you are feeling down, watch bare necessities. Thank you.
Hey, Jaya, could you put your phone number back up on the screen for people
Yes.
who are interested in taking that?
Yeah, sure, I will. There we go. Let me put it up so you can see it well. Okay. The 630-715-6881. That's my cell phone. And yes, I do have that, but I also take a break from, at 10 o'clock, that cell phone turns into Do Not Disturb, just so you know, at 10 p.m. But I'm available otherwise. But again, you know, please text and introduce yourself so I don't treat it as a spam call, because I've been getting them before that too, but I think it's just the nature of the beast nowadays. But also my email is also there. So yeah, reach out. I'll be more than happy to help.
Thank you, Jaya.
I'm going to stop sharing my screen, and thank you again for joining. And
Thank you.
Everyone.